Trauma to median nerve. The median nerve is the main nerve in the anterior of the forearm. It supplies the muscles of the front of the forearm and muscles of thinner eminence, thus controlling the movement of the hand. This nerve can be injured, and that is considered a dangerous injury. Lesions of median nerve usually occur in two places. First, at wrist joint, which is more common. Second, at elbow region, in supracondylar fractures of humerus, and this is the most dangerous, because the nerve had not given any branches yet. The median nerve supplies pronator muscles of the forearm. These muscles are responsible for pronating the forearm. They are pronator teres and pronator quadratus. Here is the movement of the forearm: pronation, supination, pronation. So, when the median nerve is injured, these two muscles will be paralyzed, causing the forearm to stay in supination position. The median nerve also supplies the long flexor muscles of the wrist and fingers, which are flexor digitorum profundus, flexor digitorum superficialis, flexor pollicis longus, and flexor carpi radialis. Actually, half of flexor digitorum profundus is paralyzed. So, there are 7 results for this trauma. Weaker flexion of the wrist joint, as the main flexors of the wrist are flexor carpi radialis, which is now paralyzed due to this trauma. Flexor carpi ulnaris, this muscle is innervated by ulnar nerve, so it is not paralyzed and still does flexion of the wrist, but at a weaker degree. Here is the flexion of the wrist joint. The forearm is kept in supine position due to paralysis of pronator muscles, as I mentioned before. No flexion is possible at the interphalangeal joints of the index and middle finger because the flexor digitorum superficialis is paralyzed and the flexor digitorum profundus is half paralyzed. Flexion of the terminal phalanx of the thumb is lost because of paralysis of flexor pollicis longus. Patients with injured flexor pollicis longus cannot do this move. The muscles of thinner eminence are paralyzed and wasted, so the eminence is flattened. The thumb is laterally rotated and adducted because abductor pollicis muscle, which is one of thinner eminence muscles, and it's also the muscle responsible for abduction of the thumb, is paralyzed. The patient will not be able to abduct his thumb. Opposition movement of the thumb to other fingers is impossible, and hand looks flattened and ape-like. The patient will not be able to do the normal OK sign. Skin sensation is lost on the palmar aspect of the lateral 3½ fingers. Sensory loss also occurs on the skin of the distal part of the dorsal surfaces of the lateral 3½ fingers.